Hello, ladies and gentlemen. I'd like to say a warm welcome to this program. My name is Reverend Larry Dorcano, and it's my delight to be sharing this time with a very special and important and influential man, a professional, a medical professional. He also happens to be an academician, and we're very glad and honored to be having him today. We're going to be talking about sex, teenage pregnancies, and STIs among young people. As you know, we all have been young and we're so young, but there's always a tendency to get out of line and to want to explore. And so but at the same time, when there are safeguards, people kind of are prevented or helped, to stay out of trouble. And so that is our focus for today. We want to talk about some of the behavioral attitudes among young people which can expose them to contracting HIV, to contracting sexually transmitted diseases, or even causing early pregnancy, for that matter. So, with the help of our guests, we'll be getting information about what's going on, and also hopefully impart some skills to our young people and also their parents on how to keep safe. Okay. Our guest today is actually Dr. J.E.A.M. Van Bergen. He was named. He's been named the Professor of Special Appointment of First Line Treatment for HIV and STIs at the University of Amsterdam here in Amsterdam, from the Faculty of Medicine. He's been an active educator and researcher in the field of sexually transmitted diseases. And prior to our discussion, of course, prior to our going on air, we were talking about some of these things. So this is a specialist in the area of sexual health or sexually transmitted diseases. Professor Van Bergen has worked also at STI/AIDS in Netherlands as a program leader since 2003, with a limited secondment to the National Institute of Public Health and Environment, which is known as RIVM. He's also the coordinator of the Chlamydia screening trial and works as a GP here in Westerpolder in Amsterdam. So, ladies and gentlemen, it's my pleasure to say a warm welcome to Professor Van Bergen. Welcome, sir.
Thank you.
Yes.
Thank you for the kind introduction also.
You're most welcome. Yeah. So, let's just kick off by asking the question. If you can give us some perspective on the state of, let's say, STIs, contraction, and teenage pregnancy among the young people here in the Southeast. Do you have any way of giving us an idea of how things are now?
Yeah, it's still that I regularly am confronted with young people with unwanted, unplanned pregnancy, abortions, which is always a problem.
Yes.
Also, the sexually transmitted infections are really a problem, and even the HIV. And it's not only the young people, even, and that sometimes we forget that sex is of all ages. Even the HIV I see in elderly people, like me, 40, 50, 60, but it's contracted earlier and you don't have any signs and symptoms. So you are not tested, so you think I'm not infected. And in fact, that's the problem with many sexually transmitted infections, that we call them sexually transmitted diseases, but often you are not diseased, you don't have signs and symptoms, and that's why you are healthy and you don't think you can contract or transmit an infection to your sexual partner. So, and 80%, 85% of all STDs are asymptomatic. So you need to be tested to know that you are free, HIV free, STI free.
Wow.
So what kind of STIs, what kind of STDs do we see here in Amsterdam Southeast or in the Netherlands? Now, some youngsters tell me the most important sexually transmitted infection is in fact an unwanted pregnancy. So it's not chlamydia, gonorrhea. And in fact, there is one statement which says that even life itself, it's sexually transmitted, and you could say life is a sexually transmitted disease if you don't like life. But I think life is worth living, and sex is a wonderful thing, but you should be careful not to be confronted with the terrible things which can happen, like unwanted pregnancies, like sex which you don't want, like sexually transmitted diseases and HIV.
Yes. Okay. So, well, anyway, let's a woman. We might get back to some aspects of the question. So, can we point to some behavioral traits which you think? Because I'm trying to get a picture of the sexually transmitted diseases among young people now, as you see it in your practice or in your research work. If you compare that to, let's say, what's happening in the past, we're going to get back to that particular question. But do you think there are some behavioral attitudes or traits which today makes our young people more vulnerable? Because in this age, there are certain things which are in this age which we didn't have before. So it would be nice to have an idea of what are some of those behavioral traits which really pose a risk to young people.
Yeah. Of course, if you talk about sexually transmitted diseases,
yes,
there should be sex involved.
Yeah.
And if you talk to sex and contracting sexually transmitted diseases, in fact, you can prevent it. But even if you don't try to prevent it, for instance in condom use, or by limiting the number of sexual partners, or no premarital sex, or choosing partners wisely, even the risks of contracting an STI depends on the partner, if he's infected or not infected. So how prevalent, how often are STIs around in your community? So if you talk about Amsterdam Southeast, or if you talk about the Netherlands, then on average, just to give a picture, there are almost 300,000 consultations about sexually transmitted diseases at the general practices or at the STI clinics. And
nationally or in Amsterdam?
That's nationally. And 1 in 10, when he's tested, it happens to be that he has an infection. What kind of infections do we talk about? Chlamydia, mostly chlamydia infections, but gonorrheal infections. And about HIV, HIV is very much stigmatized often.
Yes.
But at this time, in fact, it's a treatable disease. It's a chronic disease. You have to take your medicines. You should try to prevent it. But there is nothing to hide so much for it. And if you talk about how many people are living with HIV in the Netherlands, then we expect it to be more or less 25,000 persons living with HIV in the Netherlands. But what's interesting about that approximately 30%, 1 in 3, don't know they have HIV because they never have been tested. And the disadvantage from that is that if you've never been tested, it takes a long time before you develop symptoms. And when you develop symptoms, you are coming very late. And as a doctor, what means late? That your immune system is already affected. So there is a kind of a CD4 count, which you can see as a kind of number for your immune status. And it goes very down. And if you look to the Netherlands, then it's especially the people from non-white communities who are coming very late in care, because it's a fear of testing, but almost 60-70% come late in care. And in fact, that's a shame, because you could have detected the infection earlier and be treated earlier.
So what you're saying, if I may just interrupt, you're saying that most people, it looks like, now what I do like though, you said 25,000 people now are living with HIV in the whole nation. I think that's a very low figure.
If you compare it to, for instance, countries like Ghana or Nigeria or Zambia, I worked some years in Zambia, yes, it's very low, a low number.
It's a very low number.
If you take, for instance, the number of chlamydia infections, I expect on an annual basis there will be in the Netherlands around 60,000 to 70,000 annual chlamydia infections in the Netherlands. But HIV new infections, in total we do have 25,000 people living, but on annual basis there will be 1,000 new infections a year. That's more or less what I expect. So there is a difference. Chlamydia is much more prevalent
than HIV.
Than HIV, but HIV, the impact of HIV being diagnosed every time when I get a patient and I have to tell him that he's HIV infected, it's still, it's really something to hear that, and it's different from a chlamydial infection because then people, okay, that's stupid, and I'll try to prevent it next time, but give me the treatment.
Right. Yeah. Now, you made a point earlier, which I want to get back to. You said that you've noticed that most people from the migrant background tend to show up late to get tested.
Yeah.
By which time, sometimes damage, which could have been prevented earlier, becomes difficult to prevent or to handle because of the late reporting. Now, and I think one of the things, reasons why people do come late is the fear of knowing whether they have it or not. But the point I think you want to make is that it's not a disease that should be feared no more because it can be handled.
Yep. Yep.
So, ladies and gentlemen, if you're watching this program, we want you to know that treating sexually transmitted diseases, and even HIV for that matter, you have to realize that it's a treatable disease. And so if you have it, please, or you're suspicious of yourself, maybe having something like that, please just get to your GP and get tested. And the good news is that you can be treated and your immune system will be taken care of so that it won't cause more damage. So the fear of it being a killer disease is no more an issue, isn't it?
True. It's treatable, and we should be much more relaxed in it.
Yes.
I think we should not stigmatize the people who have it. I think we should earlier test on it.
Yes.
And that's the good thing. And the other thing still stands is that you should try to prevent it, because it's better to prevent it
than to actually go for treatment.
Than go for treatment. And that's for all STIs, of course. And then if you tell about what can you do to prevent it, there are things you can do to prevent it, and there are things you should also do, and that's the testing, which you correctly refer to. See that you are tested, especially if you have a new partner or a new relationship. My advice would be have safe sex, and if you think we are a stable partner, then have yourself tested, so that you know that you are not going to infect your partner, because that's not what you want to do with your partner.
Absolutely. Anyway, if you're watching this program and you feel like giving us a call, the studio line is 020-33-74160. It's at the bottom of your screen. You can give us a call if you want to talk to our guest, the doctor. If you have a question or you have a point of clarification, please just go ahead and give us a call. We'll be more than glad to take that call. We're talking about sex, teenage pregnancy, and sexually transmitted infections among young people. If you're a young person out there, this is your chance to ask a question. Well, whether you can mention your name or you can do it anonymously, no problem. Okay. Now, so what about today? The risk of people getting infected, do you think it's more now in our present age than, let's say, 10 years ago or 20 years ago?
Yeah. What we actually see is that people tend to have sexual relationships a bit at younger age. Now
than before.
But not so much. In fact, if you look to the statistics, then by the age of 16, 17, more or less half of the persons already did have sex.
Okay.
But 10 years ago, it was almost the same. That age of sexual onset doesn't seem to appear to become earlier. What is important to know is that more people are going to be So they are not going to be sexually active much more earlier, but more of our youngsters are going to be sexually active. So indeed, you see among youngsters that, for instance, chlamydia infections, it occurs quite frequently. And the problem also is that there is a lot of education, and even on sexual health, even parents talk about their children in schools, they talk about their children. So most youngsters then know, and the first time they have their sexual relationship, yes, they will use a condom, but they often think after 1 week, 2 weeks, that this will be the person they are going to marry, this is the best relationship. There are no signs and symptoms, so we can leave the condom. So that makes you vulnerable for the STI. So if you have a new relationship, my advice would be use condoms and use them also for the first 3 months. Then you will also know if the relationship is well. And if you decide not to use condoms, have yourself tested.
I must admit to you that, coming from a religious background or community, it's not so easy or comfortable for me, to talk about having sex with condoms and stuff like that. We generally preach abstinence, until you want to get married. Although in practice, it sometimes, it doesn't always happen, because people are vulnerable at different levels, and so sometimes people do get together sexually, before the time they're supposed to, even in the church, that we are aware of.
No, but then I totally, sorry to interrupt you, but I totally agree. Abstinence, of course, is the best way to prevent
getting infected.
And if you marry and the person you marry doesn't have any sexually transmitted infections, then there is no risk. Of course, that's the best way. Unfortunately, what we see in reality is that things tend to be a bit different, and there are a lot of people that are already sexually active, even if you don't want them, or as a parent you don't want it. The reality is that, in fact, that indeed, yes, some are sexually active, and then it's best to give them good education, good information, to prevent them from serious things to happen. And we know from research that if you give sex education, for instance, also in schools, parents are always afraid that will make them more vulnerable. They will have more sex if you promote condoms.
We need to talk about that. By the way, if you can maybe raise your voice a little bit or get closer to that'll be fine. Here inside we have a large migrant ethnic community, multicultural community, mixed with, of course, with native Dutch people. Now, we in the from the migrant background, sex is really something that you talk about basically among married couples. And so I had, now of course I can do better, because I can discuss sex, issues about sex easily and openly with my children, for example. I can do that now. But before, I don't think I could have done that. And I think most people with this background wouldn't do that, because they think it's not a child's play for you to begin to talk about sex with your children. Now, you're talking about education, sexual education. Now, this is not a common thing in our sort of community. So, in the Dutch society, do you speak or discuss about sex and its consequences with your children? And for that reason, maybe you have a lower level of sexual incidence of sexual STIs and pregnancies and what have you? No, I know, of course, Dutch young people can be very sexually active, although maybe, I don't know. But you give me your perspective, because there's a difference between the cultures a bit.
Yes, there is a difference between cultures, but within cultures, I think the difference is larger than between cultures. So even Dutch youngsters, they are sexually active, also at 15, 16 years. Among the Surinamese and Italian communities, they are a bit earlier active. But talking about sex is the issue you raise. And if you ask my parents, they will find it very uncomfortable to talk about sex, even among themselves as a couple. The new generation, and I think the younger generation, is really changing. And the Netherlands, yes, it's a different culture. The Dutch approach is that you should talk a bit more about it. On sex, on sensitive issues, because that's the reality. Why close your eyes about what is happening?
Absolutely.
And some things I think we do have, we are right, because if you see that on the statistics, for instance, in the States, they have also recommended abstinence, but in those schools where they preached abstinence, there were more teenage pregnancies and abortion than in the schools where they give proper sex education, where you could prevent having sex, prevent, if you have sex, to contract an STI or make a girl pregnant. So in fact, I think talking sex will become an important issue, because it all relates to what do you want and what do you not want. And sex, even if you, as a couple, you want to have pleasure, you have to show what you want, you have to talk what you want. And in youngsters, it's even more important, because if you look to the research, more or less 20% of the women, when they start their first sex, they afterwards they say, in fact, I would have liked to postpone it a bit. So in fact, they went into sex because they didn't talk about their boundary. I don't want sex. So to say what you want and what you don't want, if it's on sex or if it's on preventing STIs or on using condoms, you have to talk about it.
I made a point, I said some women, younger women who went into sex later on wish they hadn't done it at that point. Why did they have such an issue?
I think one of the reasons is that it's difficult to say no if you want to please someone. Sometimes there is force. There is still, unfortunately, a lot of force, or there if you do this for me, I'll give you a present. And in fact, if you liaise and relate with a person, I think it is only if you have a compassionate relationship. That's is very important also in your sexual relationships. But we were talking about how is life. Life is not always as you want it to be. And if you look to sexual health, indeed there are the nice things, but there are also the things like sexual violence, rape, youngsters who have sex at a too early age and then afterwards regret it.
So all probably has to do with maybe the state of preparedness emotionally and mentally. So when people are not that prepared because nobody told them about it, or they have not really been educated about it, then they might have some regrets along the line.
I think educating persons is very important, especially our youngsters, because they're our new generation, and you don't want your sons or daughters to contract things. For instance, the misconceptions that among boys also, that if there are no ulcers or no discharge, then everything is healthy. That you can see and judge a person if he's having a sexually transmitted disease or even HIV by looking at him. But most STDs, they don't have signs and symptoms. You can't see on a person if he's contracted with an STD or with HIV.
Absolutely. Well, the next question is, according to a Canadian website, Sexuality and Youth, it says a well-developed, broad-based sexual health program, sexual health education program can effectively, it says, help young people avoid negative outcomes, such as STIs and unplanned pregnancy. Now, please tell our viewers and listeners the type of educational program that is being run, for them currently either in our community or in our municipality.
In fact, there are several kinds of programs which are running at this moment. There is the campaigning, and one of the campaigning websites is the website from SOA-AIDS Netherlands, STI-AIDS Netherlands, where there's a lot of information available, and there are special interventions also for young people, also with social media, because that's what youngsters use now. There is, in fact, developed sex education lessons for schools, which are being executed and implemented at this time in the Netherlands, and they got a prize from the European Union to be very effective in preventing unwanted pregnancy.
Which is that program? What is it called? Has it got a name?
Yeah, it's called...
How do we recognize? Is it because we know some of these things are there, but perhaps, it's not been offered at our level, so we don't recognize it. But tell us, what is it called?
It's called Lang Leve de Liefde in Dutch. Long Live Love. And it tries to bring the compassionate message that you should take care for each other, and how does it work. So it's about information, but it's also about talking, it's about prevention, and an informed person will be able to prevent becoming infected. So that's one of the things. What we also are trying to do is if youngsters have questions about contraception, about sexually transmitted infections, want to be tested, or even have problems on sex and sexuality, like pain with having sex, like having discharge, then we have organized in our community here in Amsterdam Southeast, in the health centers, special consultations. It's called Better Safe Than Sorry. Better Safe Than Sorry. And in that consultations at your general practice, you can have a discussion with a trained nurse about all these issues of sexuality, about issues like I want to be tested, about issues like which contraceptives do we want or do we need, and I think in that way people are being informed more and more in a personal matter. Of course, the internet is another way of informing people. The problem with internet is there are always different sides on the coin, because there is misinformation on the internet, there are dangers on the internet, but there are also good things on the internet. And the website Sense, for instance, is especially for youngsters, and that's a very professional website with good evidence-based information where youngsters can seek information on sexuality, pregnancy, things like that.
But Doctor, if I may come, what I'm not getting quite from you is within the community, I have not seen, at least I'm not aware, maybe it's there but I'm not aware, of those programs targeted towards helping the young people stay away from STIs and from early pregnancy. We are here, we see a lot of young people in the city going up and down, who have given birth, so we're not sure how effective is the programs which are targeted or directed towards them to help them to stay away from out of trouble, sexually speaking. You answer my question.
Yeah. So and it's true. I see also in my practice the problems, and even the problems not only with one time an unwanted pregnancy, but a second time or an S. So. So the problem is there.
That's an issue. Okay,
it's an issue.
Okay, that's what I wanted to be sure about, because
it's an issue, and we still have to improve. We still have to do better. We are already doing better, because if you compare how is the situation now with how it was 10 or 20 years ago, yes, we are doing better. But human behavior is difficult to change, and we are trying. We are moving on, and one of the issues is indeed from trying to prevent, and prevention starts with talking. That's, I think, where I really believe in. If you don't talk about it, then a lot of things happen because of the fact that you don't talk about it.
Yeah, and talking about it, like you're saying, the level of talking. You said earlier on we're comparing the typical Dutch family with maybe the migrant family, you say, well, your parents wouldn't talk about that.
Even I would I would have felt uncomfortable with our parents.
Precisely. But now we are living in different times, so maybe it's easier now than then. But still, living inside, working inside is, I'm sure you deal with a lot of migrant people. You think there is more openness in talking about the issues of sexual health than there used to be?
My impression, certainly it is. There is a lot of
more openness about it.
Yeah, much more openness, and there are a lot of more questions. So I do see, if you compare how the topic of sexual health is raised in the Netherlands, but also in Southeast, that is different than, for instance, the way it's in the UK or it's in the States. So I really think we in the Netherlands and also in the Amsterdam community, we are increasing, we are talking more about sex, and I think that's a good thing. At the end, it's a good thing because not talking about sex appears to give more problems and less good perspectives for the children. So I think we are doing a good thing.
No, because we know that in the schools they maybe give sex education, but also give condoms and all that, and most parents don't like the idea. I've heard parents complain about that. So I don't know whether you are aware, and SOA8 is aware about this sort of opinion people have, and whether they are trying to work around that, so they have a common understanding with the parents as to what is better to do to help the kids to stay out of trouble. I mean, SOA8 really in touch with parents regarding this aspect of the education.
Yeah, even the issue of it's not only condoms, it's talking about abstinence, it's talking about what can you prevent more delaying your sexual relationships, because we know that some people think that if you show or distribute condoms that you will promote promiscuity. That's a bit. But the facts, that's if you go to, is that really true? We think that, then we see a different, then we see that when you give the education, that people are postponing their sexual debut, their first sexual experiences, and when they have sex, they use condoms, so they prevent unwanted pregnancies and teenage pregnancies. So yes, there is reluctance. Certainly, there is reluctance, and you should discuss it. That's an important issue, and you should give the entire perspective. What do we know about sexual behavior and how to prevent unwanted pregnancies, sexually transmitted infections? And certainly, I think it's not only condoms and promoting condoms. Even so, it's trying now to make websites how it's easier for parents to discuss difficult behavior from their children, because it's not only about sexual behavior, it's also about drinking behavior, drugs behavior, going on holiday. How can you discuss with your child those difficult issues? And it's in fact the same story which I would tell, that if you don't talk about the problems of alcohol, drugs use, then it seems the problem is bigger. It's better to be prepared also for your children, and to prepare them, you have to talk about it.
Yeah. Okay, absolutely. Well, so hopefully our viewers would take a cue from this. We may not have been brought up to talk about issues like this, but it is very important for us to learn to move with the times in dealing with this kind of issues, talking about it. I mean, there are different ways to talk about a subject. You can talk about it in an educative format, and the kids will learn, and they will have a healthy interest to ask questions and to discover more. Thank you very much, Doctor. So which lessons have you learned, especially in dealing with these issues within the migrant community when it comes to sexual issues, sexual health, STIs, teenage pregnancies? Which lessons have you learned in dealing with the multicultural community such as ours?
I think one of the issues is that sex and sexuality, it's really an important issue. It's a topic. It's also a good sign, and it's vibrant, and you see it in the African community. I see it also in the Caribbean community, and I think that's something which I like. And it's not only on being sexually active, but it's a kind of lightness in being. So, and I do think that sex is an important issue. We don't talk much about it, but sex is life, just as you need to eat, you need to drink about life. Sex is an important issue, so that's something which I like. My other experience is that although the appearance of that sex and sexuality is important, talking on sex, it looks as if it's easier for me talking sex with Dutch patients than with the migrant community. Also, as a doctor, I have the advantage that as a doctor you may ask questions. You need to ask questions because otherwise you can't give a good treatment. So you have to talk. So it's easier for me as a doctor, but I'm not sure if as you said, talking about sex and sexuality is easier among Dutch couples in the Dutch community than among the migrant community. It might be an issue, but my personal impression is that with some patients it's very easy, with others it's difficult. So again, I would say that the difference within a culture are larger than between cultures.
Okay, I see what you mean now. Okay, all right, okay. Well, I was expecting some more experiences you have had. Okay, how about young people? Did you deal with young people as well in treating them, over the period of time, treating STIs and the course of treatment? Have you noticed something? Have you learned something that you didn't know before? If something it doesn't come to mind immediately, no problem. I was just curious about that.
No, one of the issues. No, it isn't. There is not a special thing which comes up.
Okay, no. Well, another sensitive question. Now, what about abortions? Have you encountered like young ladies who have tried to have an abortion in their own way, maybe because they got pregnant unexpectedly, and now the nervousness and the fear of hiding it from the parents or from people they know may have driven them to want to try to commit an abortion because somebody said drink this or drink that and you'll be fine, Have you encountered young people who were in this situation with an unwanted pregnancy? And how did
it's always very difficult to get the insights, but often you are confronted with an infected abortion. It might be due to an induced pregnancy.
What do you mean by that? Infected abortion and induced?
If you have an abortion, and it can be an induced abortion or a normal abortion, because a lot of pregnancies, in fact, if you have not all pregnancies also continue. There are a lot of pregnancies which even after 6 weeks, 8 weeks, 12 weeks, they might not fit very well in the womb, and you get an abortion. And sometimes such abortions can become infected. It is very rare, but once it's infected, it's strange, and then you go on thinking what might be the reason. And sometimes it's because there was an existing STI, sexually transmitted disease, which can cause the infections. But it could also be that it is an induced abortion. For instance, in Africa, where I worked for some time, a lot of the abortions were indeed induced, and a lot of infections were there, and even people die, and a lot of people died, a lot of women died from those infected abortions. So it's really a problem. Here in my practice, I don't see it a lot. I don't know how much it happens, but the stigma of having an STI or the stigma of having an unwanted pregnancy, in certain communities it's quite high. And again, there is a lot of differences because, for instance, in the Surinamese community, even if you have a teenage pregnancy, oh, my mother will take care of it. So there are differences even within communities and between communities in how parents deal with these kinds of issues. And again, if you are able to discuss it with your daughter, it will be, I think, better than not discussing it, because then you don't know what's happening. It's going underground, beyond your control. You can't help anymore. And as a parent, I think even in those situations which you don't want your daughter to be confronted, you still need to have, I think, open communication, how you can help her. Also,
so you're saying if, let's say, a girl gets pregnant unexpectedly, as disappointing as it might get or become to the parents, they should, in a mature, in a reasonable way, deal with the girl, with that issue in her life. Is that what you're saying?
I think it's easier for the girls to know that your parents are open. They won't throw you out. You still will be their daughter. It might be that she chooses not to discuss with the parents, because it's always difficult. It might be that the parents choose not to discuss. But if it's a very difficult issue for the parents, it means it's a very difficult issue for the girl, and the girl is already having a difficult time. So my point would be, try not to harm too much. Try to do good and not harm.
Okay. Yes. Okay. Well, finally, I might just want to ask you, how do your programs, specifically, our young people, I'm talking about the educational programs and campaigns which you have now, just give us a general idea. How do they help them to delay, for example, first sexual encounter, how to delay the risk of contracting an STI, and the risk of an early or unwanted pregnancy?
What we in fact see, that the age of sexual onset, that means the age that most youngsters are having their first sexual experience, is not going down. And in some other countries, it's going down.
What's the average age?
On average, it's 16.5 years. That's the average. So 50% of the youngsters at the age of 16.5 will have had sexual intercourse, and half of it will not. So it's quite a high percentage, but if you look to 20 years back, it was also half at that age. So I think that's one of the trends which you can see, and it's difficult because is that exclusively due to the fact that we have our prevention campaigns? Because the prevention campaigns are changing. You don't see them as visual as they were 10 years ago, because I still remember this have safe sex or no sex. Those campaigns on the billboards and but that's more or less also due to the fact that for youngsters the billboards didn't appear to be quite effective, and it was much more important to go to an emotionally significant way of communication. That means more private, more personal, with parents, with sex education. It was much more effective than the millions going to the posters and the banners. And what youngsters also want is to find their good information on the internet, because the internet is the information platform for youngsters, and that's also where they share and deal. So a lot of the new programs and campaigns, they are in fact in the social network. So we as older adults, we don't see them anymore, but they are in fact much more prevalent.
Interesting. So what would I find? I mean, if I want to know what's going on in the social media area for sexual campaigning against STIs, how do I get connected with such a stream? How would I know?
The best thing would be go to certain websites. Websites, for instance, like So AIDS Nederland, or websites like Sense Info. There are chat forums, information forums, and if if it's valuable information which you can share it with your friends via the social media network. You can start a discussion on a certain topic. even the new campaigns, it's interesting, but you should ask our campaign leader. They are working, they are not making films like we used to make, but they are asking young people, if you would make a film, how would you make a film? So you make a film, you make a film, and they are making the script for a film, the youngsters itself, and then more and more youngsters are getting involved. And in fact, before the film that's going on the internet is made, already 300,000 people are being thinking and involved. So that kind of networking in social media, making themselves their own prevention campaigns, and then the best scripts get some kind of prize or an iMac or whatever. That's the new way of campaigning. And indeed, it's what you say. It's not more as visual in your neighborhood, but it's your virtual environment where you see it.
Thank you. Okay, on this note, we would like to bring the discussion to a close. But before that, is there a final word you want to leave with our viewers regarding the topic of our discussion today? Is there anything you want them to know, either about your campaigns or about the work you're doing, about yourself, about this topic? Just go ahead and say a few words to our listeners, our viewers.
I liked it very much, talking with you, and thank you very much for inviting me. The topic which I think I would like to share is the fact that sex and sexuality, it's an important issue in life, and we should take the good thing of it and prevent the bad thing of it. That's in fact that would be my message. And especially in the field of sexually transmitted infections, yes, we have a lot of treatments, but it's really better to prevent it. My message, which I would like to convey, is take the good things and leave the bad things.
Okay. And also, of course, he has said from the beginning that it is good to go for a check or a test, because that way you can save your life. If you have a hidden sickness or infection which has not been tested and is there in your system, it might end up destroying your life, maybe cutting your life by 10 years. But if you test and you know about it, the treatment can begin as soon as possible. So on this note, I would like to thank you very much, Dr. van Bergen, for your time and for the message you shared with us. And we hope to have you again if the occasion demands.
Thank you.
Well, viewers, thank you very much for spending this time with us, and we hope you've taken some lessons from this. And if you want more information, of course, just go to www.majestytv.org or www.radiovoiceofniger.org, and you might get more information, or just drop us a line at majestytv@live.com, and we'll be more than glad to connect with you. Thank you so very much, and please take good care of yourself and keep watching Majesty TV. Bye-bye.